You have 3 minutes to prepare. You've analyzed the roll card. You've scripted your anchors. But then the clock starts, the interlocutor begins to ramble, and suddenly, you're just a student again, following their lead. This is where most B+ grade dreams die. Today we finish the ASE Framework. Phase 3 is Execute. I'm going to show you how to take that senior consultant script we built in Phase 2 and use it to physically and linguistically dominate the room. If you want to finish every task on time while sounding like the expert in the room, this is the video for you. The biggest mistake in execution is being reactive. A reactive doctor waits for the patient to stop talking. They ask, "Is that okay?" after every sentence. They are searching for approval. A senior consultant is proactive. You aren't seeking approval, you are providing a service. In Phase 3, we use the pivot and the time check to maintain clinical authority. Execution isn't just about what you say, it's about when you say it. At the 3-minute mark of your role play, you need to execute the authority pivot. Even if the patient is still talking about their symptoms, you must bridge to the management plan. Try this. I hear your concerns about the pain, and we will address that. But for us to move forward with the treatment plan, I need to discuss the next steps with you now. You've just acknowledged the patient, but you've taken back the steering wheel. That is Phase 3 execution. In English, a rising tone at the end of a sentence is a question. If you use it for your management plan, you sound uncertain. Senior consultants use falling intonation. You aren't asking if the patient will take the meds, you are prescribing them. Listen to the difference. A junior doctor might say, "We should start some antibiotics?" While a senior consultant says, "We are going to start a course of antibiotics." That is the ASE Framework. If you analyze properly, script your anchors, and execute with authority, the B+ grade is a mathematical certainty. You've stopped being a student and started being the specialist. And if you're still not sure where you're leaking marks, we've put the link to the 60-second gap audit in the description. It will tell you exactly which of these 3 phases is holding you back. I'll see you in the next video on our channel.